Hello, this is Josephine Masita, and I'm doing the teaching presentation. My audience is a pre-licensure nursing student. My two topics are going to be nutritional assessment and domestic violence assessment. I'll start with the nutrition assessment. The purpose of a nutrition assessment is to identify individuals who are malnourished or are at high risk for developing malnutrition, to provide data for designing a nutritional plan or a plan of care that will prevent or minimize the development of malnutrition, to establish inadequate food intake due to recent illness or other psychosocial events that may lead to decreased appetite. The teaching objectives will be at the end of the teaching presentation, the student will be able to identify patients with poor nutritional status. After the teaching, the learner will identify and recognize factors which contribute to compromised nutritional status. After the presentation, the student will be competent in completing a nutritional assessment independently. The definition of nutritional status. Nutritional status refers to the degree of balance between nutrient intake and nutritional requirements by the body. Nutritional balance is affected by many factors, including physiological, psychosocial, developmental, cultural, and economic. Under nutrition refers to when nutritional intake is inadequate. This is common among vulnerable groups, which include infants, children, pregnant women, people with low incomes, and older adults. On the other hand, overnutrition is caused by consumption of nutrients such as calories, sodium, and fat in excess. This will lead to obesity, type 2 diabetes, hypertension, stroke, gallbladder disease, osteoarthritis, and many other diseases. The assessment requirements. A Joint Commission, in short JCO, requires that a nutrition assessment be completed on every patient within 24 hours of admission to determine their nutritional status. The most popular method of obtaining dietary intake information is the 24-hour recall. The patient is asked to complete a questionnaire or to answer interview questions to recall everything eaten within the last 24 hours. This gives an idea of the patient's intake over a specified period of time. The parameters used for nutritional screening include changes in weight, conditions associated with increased nutritional risk, diet information, and routine laboratory data. Tools used for nutritional screening. The first one is malnutritional screening tool, which is used for patients in acute care setting. The mini nutritional assessment, MNA, is used in nutrition assessment in older adults in long-term care facilities or in the community setting. Symptoms of malnutrition. The clinical changes associated with malnutrition include obesity, marasmus, kwashiorkor, weight loss or weight gain for that matter, failure to thrive, type 2 diabetes, hypertension, stroke, gallbladder disease, osteoarthritis, vitamin and mineral deficiencies. Culture and nutrition. Culture plays a big role in nutrition. Each person has a unique culture that may affect their nutritional status. People from different cultures attach special meanings to different kinds of food. Immigrants from other countries would prefer to maintain their traditional diets, which does not always happen because they find themselves in a new country with a new language and in a new society. They also find the food is unfamiliar. The food storage is different. Preparation of food and buying habits are also very different from what they're used to. Low income due to difficulties finding jobs, lack of employment associated with language barrier. The actual assessment. The nurse plays a big plays an important role in nutrition assessment. Nutrition assessment involves asking the patient the following questions. What is your ideal weight? And ask the person if they have lost weight in the last 3 months. If they answer yes, then ask if their weight loss has been intentional. If they answer no, then a full nutritional assessment needs to be completed as follows. If they have lost at least 5 pounds, this is a green light for nutritional concerns. Assess for recent changes in diet. If they say their diet has changed, have them state if there are any reasons why they think their diet changed. To evaluate what and how much a person is eating, what their eating habits are, assess the patient's daily meal intake, assess what they ate on a typical day, assess what they ate for breakfast, lunch, and dinner in the last 24 hours, what comprised of their meal, how many servings from the different food categories at each meal, this will show what the person's meal plan has been. What snacks does the person eat between the meals? Are they healthy snacks? To continue on the nutrition assessment, assess what kind of fluids they drink and how many drinks they have a day. Assess for the presence of weakness, fatigue, issues with mobility, getting up and moving around. This will be a sign of nutritional deficiency. Does the patient report skin problems such as bruises, pallor, pressure ulcers, sunken eyes, etc.? Then find out if the person has gone through any grief or loss of a loved one or family member in the last few months. Psychosocial events may cause a decrease in appetite. Then find out if the patient has a history of depression, anxiety, or any other psychiatric diagnosis. Research has found that psychosocial stress may affect a person's normal eating habits. Find out if the person is taking medications and what medications they take every day. Some medications are known to suppress appetite. Ask them what their nutritional goal is. The person may be at their optimal nutritional status. Assess if there are any beliefs or other conditions that may put a person at risk for malnutrition. In conclusion, optimal nutritional status is achieved when sufficient nutrients are consumed to support the day-to-day needs of the body. People at optimal nutritional status are more active, have less physical illnesses, and live longer than people who are malnourished. Then to start on domestic violence, still the audience is a pre-licensure nursing student. The objectives of a domestic violence teaching will be at the end of the teaching session. The student will be comfortable in completing the basic domestic violence assessment. The student will identify a patient at risk or experiencing domestic violence. The student will be confident in assessing and reporting domestic violence. Definition of domestic violence. Domestic violence is a pattern of abusive behavior in any relationship that is used by one person to gain or maintain power and control over another person. This can be physical, sexual, emotional, economical, or psychological threats that influence another person. Behaviors that intimidate, manipulate, humiliate, isolate, frighten, terrorize, coerce, threaten, hurt, injure, or wound someone else will be considered domestic violence. Types of domestic violence. There are different types of domestic violence. The first one is intimate partner violence. This includes spouses or non-marital partners, such as people who are dating, for example, a boyfriend or a girlfriend. This is divided into physical and or sexual violence. Sexual violence by use of physical force or threat of such violence, psychological or emotional abuse, and or coercion tactics. Another type of domestic violence is child abuse or neglect. Child abuse is defined at both federal and state levels. The Child Abuse and Protection Treatment Act, CAPTA, dictates that minimum standards that must be incorporated into state statutes. Neglect is failure to provide for a child's basic needs. They could be physical, educational, medical, and emotional. Physical abuse causes injury from punching, beating, kicking, biting, burning, shaking, or harming a child in any other way, intentionally or otherwise, is considered abusive when done purposefully. Sexual abuse of a child includes fondling a child's genitals, incest, penetration, rape, sodomy, indecent exposure, and commercial exploitation through prostitution or the production of child pornography. Emotional abuse is a pattern of behavior that harms a child's emotional development or sense of self-worth, belittling, rejection, threat, and withdrawal of love and support. There are many possible long-term physical and psychological effects of child maltreatment. Immediate consequences may include injuries such as bruises, fractures, and lacerations. More severe injuries such as traumatic brain injury, TBI, may result from shaken baby syndrome. The maltreatment may result in death in some cases. Another type of person that is affected by domestic violence is the elders. This can define elder abuse or neglect can be defined as intentional actions that harm or create a serious risk of harm to a vulnerable elder by a caregiver or a person who stands in trust relationship to the elder. Failure by a caregiver to satisfy the elder's basic needs or to protect the elder from harm. Elders may be subjected to physical abuse and neglect, psychological abuse and neglect, and financial abuse and neglect. Complications of elder abuse may range from minor pain to life-threatening physical and non-physical consequences. Adult domestic violence assessment. Some domestic violence questions to ask an adult. Ask them, do you feel safe at home? This broad question will prompt the patient to talk about their situation at home. In so doing, the patient might open up and talk about domestic violence. Another question that could be asked, has anyone physically, emotionally, or sexually abused you in the recent months? The rationale here is to get the patient to admit to any abuse going on at home. Another question that you could ask could be, do you have any concerns about your partner that you would like to talk about? The rationale here is to have the patient talk about any bad illegal habits such as abusing drugs and all alcohol, substance abuse or use may be causing the patient emotional, financial, or other safety problems. Another direct question could be, tell me about your relationship with your wife or your husband. What do you do for fun? The rationale here is that the abuser may be using isolation to control the victim. The abuser may be monitoring who the victim sees, talks to, or where she or he goes. In conclusion, the Joint Commission, JCO, requires that all healthcare settings have policies and procedures to assess, document, and make referrals for all kinds of family violence, including child abuse. Be aware that different states have some form of mandatory reporting of elder neglect and abuse. In most states, nurses and all healthcare workers are mandatory reporters as a mandatory reporter, you need only to have suspicion of elder abuse to generate a phone call. And that's all I have for you. Thanks. Bye.